So here is the picture of the stroke. You can see MRI can help us to see whether stroke is it due to blockage or is it due to bleeding in the brain. And then here is the MR angiography. So MR angiogram is non-invasive. Just lie there, the scan, and then you can see the blood vessel. You see the right side, the blood vessel is less wide. That means there's a blockage in the artery that causes the stroke. Here the CT angiogram. This is non-invasive. Just lie on the scan. Within minutes, the scan is so fast that can detect. So you can see the vessel at the top there. You can see here there's a dark area, that is a thrombus, the block. You can see when we do the CT scan, we inject the contrast or dye, so that you can see the white one is the dye will pass through here. And then here there's no dye because of the cholesterol plaque, okay? And then here you can see the almost broken out the blood vessel, that means it's near complete obstruction of the artery. So without any invasive procedure, we know that there is something wrong. Then we can plan whether to go for bypass or balloon angioplasty. Nowadays, a lot of centers also do this angioplasty. No need operation, just a small needle hole. They'll go in and put the wire and then put the balloon to open up the blockage and put a stent to keep the blood vessel open. I'm sure you are exposed to all this, but the message is prevention still better than cure. Don't wait until this one and go for a high-tech treatment. So some patient come in just for lung problem, a lot of fluid in the lung. When we check, patient have tuberculosis or TB or Fei Lao, okay? So this is another problem with the diabetic patient. The resistance is low. They can get infection everywhere, not only the leg, the hand, the brain as well. So this patient come with fever and then become very delirious, unconscious. When we scan, this is an abscess, Senana in the brain, okay, abscess. So this is another this is an angiogram to show a blockage in the blood vessel at the neck. So patients sometimes got intermittent stroke. We call it a transient ischemic stroke. That means they got stroke, they cannot move. After 24 hours, they recover again. Then another few days, they got stroke again, but they recover. So this is a warning sign there's something wrong. So when we check, there's a blockage, okay? You can see the narrowing here. And then sometimes the patient have the leg numbness, and we check. Also here, there's a blockage of the blood vessel at the leg. Okay, so treatment or complication, of course now we have a lot of high-tech treatment where we can like blockage in the neck. You don't have to go for surgery also can. If it's early enough, we just put a stent, like putting in the stent in the heart to open up the blockage. Okay, this is after the unblocking of or putting a balloon to open up the narrowing. This is a normal scan after the procedure. Okay. Also now a high-tech thing, you don't have to put surgery. We just put a small tube to drain out all the water in the lung. Okay. So important message here is prevention is better than cure. So don't wait until you have the diabetes. Now remember to take less sugar as our container here to give to everyone here. To remind us, take less sugar because diabetes is no cure. So don't wait until it's too late. Then a lot of patients have problems. Some patients even lose their leg because of the infection of the leg. They have to saw off the leg and have to put the artificial leg. So our message here is prevention is better than cure. Take less sugar for healthy life. Thank you.